ask you, how is this going to work with your pharmacy, and how many people can Walgreens alone vaccinate in a single day?
Yeah, we're first of all are very excited about the fact that we are rolling out this program so that we can start to vaccinate more broadly. I think what you're going to see is the program itself is actually going to start slowly before it starts to ramp up. And you're going to see that the 1 million doses that you heard about up front, a subset of those will go into our stores. We're supporting about 15 states and jurisdictions right now, and you're going to see that ramp up as time goes on.
How are you going to handle those crowds? And how will people know when they can get theirs? Will that still go through the state, or will it go through the pharmacy app, for instance?
It's actually both. And I'll tell you that the pharmacies will certainly help to educate, but we will be pointing back to local health system and health departments so they understand who's eligible and who can actually receive the vaccines. So I talked about the 15 states and jurisdictions that we're going to be supporting up front. Just to put that into context for you, that's about 170,000 doses is all we're going to receive for the first part of this launch. And so they'll have to understand, are they eligible? It'll be different in New York City versus Mississippi. And they just have to understand, am I eligible? How do I then go and sign up through pharmacy apps to make sure that I'm eligible and can get the vaccine?
Well, Rick, 2 weeks ago, the governor of New Jersey, Phil Murphy, was on this newscast and blamed pharmacies for the slow rollout numbers in his state. Here, listen to this.
The big reason is the federal program with CVS and Walgreens. They basically amass these doses. They schedule visits to long-term care, nursing homes, extended living, and they're slower. They're punching under their weight, particularly Walgreens. And that's where most of the yet-to-be-used doses are.
Is he right, or what do you have to say about that?
The entire program, I think when it started, the government asked if we could lean forward and help, and certainly we said that we would. We knew it wasn't going to be perfectly smooth from the beginning, but I'll tell you that early on there was some hesitation from the long-term care facilities and staff. We had some challenges with some states choosing Moderna versus Pfizer, as well as how we want to prioritize the different groups, hesitancy and scheduling as well. What we saw is that a ramp up of that has continued pretty religiously since that point. We vaccinated about 1 million long-term care residents in the first month and about 1 million in the last week alone. So you have seen a significant ramp up in what we're doing, but a lot of learning along the way as well.
My Walgreens is pretty busy. Will this be an out in the parking lot kind of thing? And who will handle the crowds and decide who can go and who can't?
Yeah, remember, we talked a lot about the fact that it's going to be scheduled and appointments are going to be the way that we want to do this. Safety is the number one thing that we need to make sure that we're doing. And all protocol states that we have to have time to monitor patients after the vaccine as well. So there won't be crowds. It's going to be scheduled. We'll make sure we have appropriate time and spacing for those getting the vaccine. And then once they know that they're scheduled, we'll make sure that our healthcare professionals are there to give them the vaccine and monitor them appropriately. So no, it's not going to be out in parking lots. You'll see it in our stores, but we'll make sure that we have safe and appropriate places to do the vaccinations.
Rick Gates from Walgreens. Rick, all the best and good luck. Thank you. Shepard Smith here. Thanks for watching CNBC on YouTube.